Hello guys, good evening. This is Abhay Chakra. Uh, I'm currently holding the position of the president at the Circular. It's a non-profit organization. I'm one of the founding members of this organization. So this organization is completely focusing on advancing sustainable operations and achieving circular economy. And also I'm holding the position as Director International Relations and Communications at Digital Education and Skills Council. So besides this, I very recently co-founded a deep tech startup also called Yudiz Solutions. So coming to my sustainable journey, I started off in a very simple way, like on behalf of the circular when we were trying to achieve the sustainability in our own neighborhoods and the residential communities. We started very simply by cleaning the communities. That's what we used to do. But later on, we understand like this needs a behavioral change. Okay. But let me ask you something. I mean, why? That's the most important question because when we speak about behavioral change, people need to understand that that's important. But today's scenario, like I've interacted one-on-one with many people, but there seems to be this lack of responsibility, and in fact, they don't even want to take any accountability for all the things that they have been doing. That's the main problem. So this is a very broad topic, effects of climate change on health, but I'll try to explain you and make you understand in a pretty good way. Hope so. So as we witness the Earth's climate rapidly shifting, we must acknowledge the significant impact that it has kind of on the health of our people. Let's say rising temperatures, extreme weather events, or else shifting weather patterns or rainfall patterns, sea level rise, and just a few other alarming consequences that we face. These are all to be considered. The effects of climate change on human health, in fact, in India, are far-reaching and they demand our attention to kind of and also an immediate action. So first and foremost, let us consider the rising temperatures. Heat waves have become our frequent and intense, and especially in urban areas. The scorching heat takes a toll in our bodies and obviously leading to heat exhaustion, heat stroke, and even loss of life. Vulnerable populations, including the elderly, children, and those with pre-existing health conditions, bear the brunt of these extreme temperatures. But I wanted to ask the main question: is this kind of democratic? Because let's say the people who are not affected, or at least the people who think that they are not affected, are vulnerable, but the people who are already affected are even more vulnerable. That doesn't seem like democratic, at least me. And we felt that that's not fair. So we started asking many questions. Moreover, the changing rainfall patterns disrupt our agricultural systems and water supplies, resulting in the food insecurity and waterborne diseases. Flooding, that's another consequence of climate change, not only causes the immediate injuries and fatalities, but also kind of leads to the outbreak of waterborne illnesses like cholera and typhoid. So our farmers who mainly rely on these predictable weather patterns for their livelihoods are forced to unfortunately grapple with the uncertain harvests. So this is impacting their mental health and also economic. This is causing economic instability. I myself, since I'm from Hyderabad, obviously Indian cities are prone to these floods. I kind of stood in the middle of these floods in the Hyderabad city, and it was shocking to me to see all kinds of the furniture sets, sofa sets, mattresses, used clothes. I mean, they're just floating on these floods on these roads, passing through all these residential colonies. I've seen an entire furniture world, and that is the pathetic situation that we are currently living in, all because of just the negligence. So the impact of climate change and in fact air quality control cannot be kind of overstated. Rising temperatures exacerbate this air pollution, particularly in urban centers, and toxic pollutants and all the other things, smog, fill our lungs, contributing to respiratory illnesses such as asthma and chronic obstructive pulmonary diseases. So in fact, liver is also kind of in a vulnerable state in this scenario. So the most vulnerable among us, including children and those with respiratory conditions, suffer the most. We cannot ignore that fact. Every breath we take is now laced with the consequence of climate change. One other thing is, additionally, the climate change affects the spread of vector-borne diseases. Mosquitoes, for instance, thrive in warmer temperatures, and being India a tropical country, this increases the transmission of diseases like dengue fever, malaria, chikungunya, and these diseases claim countless lives and burden our healthcare systems, which are already grappling with limited resources. That's the main problem, particularly in our country. So the only kind of, there are multiple effects of climate change, and we thought like we need another surveillance system in this country to make sure that we are at least preventing these diseases. The main reason is, generally we tend to think of traditional surveillance mechanisms whenever we speak of any health surveillance thing, but that's not the case here. We have to make sure that we are also implementing syndrome surveillance. Just the habits and all that itself, when we group together the symptoms, we'll be able to come up with at least more than 85 to 90 syndromes, and this group of symptoms will be eventually grouped as syndromes, and these syndromes will help us to understand the better scenario. That is the reason we started this nationwide health surveillance project on behalf of Digital Education and Skills Council. Let me share one thing. I think it's not okay. Let me do one thing. I'll just explain you what exactly we are trying to do in this Digital Education and Skills Council. So we aim to establish a comprehensive system for tracking and analyzing and also kind of curbing all types of outbreaks in our country. This includes integrating different preventive healthcare services. The project takes into account several factors, maybe including demographic data, healthcare data, and behavioral data, and all those things. We not only address these physical ailments, but also the deep-rooted psychological challenges faced by individuals living with chronic illnesses. So that's one of the key things that we're trying to do here. So through our comprehensive surveillance approach, we go kind of beyond the surface to understand what exactly is happening on ground, and at the same time provide real-time insights. So these conditions have on mental well-being. Our surveillance efforts provide real-time insights. By leveraging this data, we will be able to develop targeted mental health resources, raise awareness, reduce stigma, empower patient advocacy, and build strong support networks. The one thing that we are doing is education plays a vital role in DES's surveillance project by contributing to the success of preventive healthcare services and addressing various factors and variables involved. Health literacy and awareness, education plays a key role in improving health literacy and raising awareness about various health issues, preventive measures, and healthy lifestyle choices. By providing education on this disease prevention, symptoms recognition, and early intervention, individuals can make informed decisions about their health and take proactive steps to prevent diseases. So this knowledge empowers individuals to actively participate in their own healthcare, and that obviously leads to better health outcomes. As I said earlier, behavior change is one such thing that is pretty impossible to achieve, but through education, we think that we can. Education can influence behavioral change by promoting healthier lifestyles and preventive practices. By providing information on the risks associated with unhealthy behaviors like smoking, alcohol consumption, or kind of poor nutrition and lack of physical activity. Educational campaigns can encourage individuals to adopt healthier habits. This in turn can reduce the incidence of chronic illnesses and contribute to overall improved health indicators in the population. Yeah, targeted interventions are the most important thing. We here through this council trying to make sure that education allows for targeted interventions tailored to specific demographic segments or communities. By analyzing demographic data and health indicators, educational campaigns can be designed and to address the unique needs and challenges of different population groups. For instance, education on prenatal care and child nutrition can be targeted toward expectant mothers and young families, while campaigns on cardiovascular health can focus on middle-aged or elderly populations. So through this, we can empower communities to actively participate in health initiatives. By engaging these community leaders, organizations, and stakeholders, educational programs can foster a sense of ownership and responsibility towards this healthcare. Obviously, these communities can be educated about disease surveillance, symptom recognition, and reporting mechanisms, enabling them to actively contribute to the early detection and containment of outbreaks. This participatory approach strengthens the overall effectiveness of the disease surveillance system. We are trying to bridge the socioeconomic gap here, because education can help bridge the socioeconomic gap by providing equal access to health information resources. By addressing socioeconomic factors like, let's say, income levels or education levels or housing conditions, education can empower marginalized communities with knowledge and resource to prioritize their health. So this reduces health disparities and ensures that preventive healthcare services reach all segments of the population, irrespective of the socioeconomic status. One thing that we are trying to do, which is generally not possible here, but yeah, this might seem audacious, but education plays a crucial role in facilitating the adoption and utilization of technology for healthcare purposes. Through educational campaigns, individuals can learn about all these telemedicine, health apps, and digital platforms that provide access to healthcare services, remote consultations, and health monitoring. So by promoting digital health literacy, education enables individuals to leverage technology for preventive healthcare, thereby improving access and convenience. So it is highly impossible for kind of explain all the things that we are trying to do, and particularly when it comes to climate change, impacts of climate change on health is a very broad topic, as I said. But one thing is, climate change is real. So what we can do, the impacts of climate change there are many things like sea level rise, or else wildfires, whatever. Like there's a huge rise in temperature, and there are many such things. So climate change is real, it has consequences, and it is affecting human health. I wanted to touch upon one specific thing that is called light pollution, but because at least you'll try to, this will help you understand in what way climate change is real and how can we impact human health in ways that we don't even imagine. Light pollution is something that we generally tend to ignore, but you know what? Light pollution is one of the main causes for non-alcoholic fatty liver diseases, and there are other things like breast cancer and also mental health issues, mental disorders. The reason being, we are tuned to one thing called circadian rhythms. Our biological clock is something that is so much associated with the nature, and even if we try to pull out ourselves from that thing, it's not possible because it is some thousands of years of evolution. So this circadian rhythm is something that we can't ignore. But with this light pollution, what's happening is there is an imbalance in the melatonin levels and cortisol levels that are generally tend to be happening in our body, which obviously creates a problem. Do you know why? Let's say you're all sitting in a gloomy under a gloomy light in some closed room. Okay, when you're supposed to be exposed to the daylight, under the sun, that's not happening. And when you're supposed to be sleeping, when you're supposed to be shutting down, switching off all the lights and make sure that you're peaceful and sleep, then you're not doing so. You're actually sitting under the lights in the same closed rooms, and you're exposing again yourselves to all blue light. At least previously, what we used to have is some sodium lights, but now since we got these new LED lights, these LED lights emit blue light and also some ultraviolet spectrum. Blue light is something that is very dangerous, and blue light is in fact the highest scattering light, because even if you see the sky looks blue, because that is what is the most scattered spectrum. Same with the blue light. All these LEDs emit blue light, and that confuses our biological clocks, which is circadian rhythm. And obviously, we tend to uh, kind of slip from our biological clocks and the regular metabolism that is expected from our bodies. So this is creating a lot of unwanted, unpleasant consequences, all mental health issues, psychological problems, and all. So this is the reason we thought of like I just wanted to share a plan of action to encompass these multiple strategies, including data analysis, education, community engagement, and technological development to ensure the success of this project. Let's say the first main thing is we made sure that we bring all the publicly available health data. So to understand the geographical outbreaks of various diseases in India and also few other countries based on their own respective research. So this data will serve as the foundation of our analysis and model development. So data collection, yeah, we gather relevant data from multiple sources. This data will compass information on disease prevalence, uh, patient demographics, geographical locations, and environmental factors. Then once it's done, we'll do data cleaning, integration, exploratory data analysis, feature engineering, model development, and proceed with model training and validation. So once the model is validated, we'll perform root cause analysis. Why this is important? In addition to predicting disease patterns, our model will enable us to conduct root cause analysis by analyzing the relationships. These relationships are between various factors, including demographic information, environmental conditions, lifestyle choices, and disease occurrences. We can identify potential root causes and risk factors associated with these different diseases. Then obviously this information will help us to make informed targeted interventions and come up with preventive measures. And the one innovative thing that we have done is school outreach program. So we came up with multiple things, prepared interactive infographic materials and brochures, curriculum integration, then came up with distribution and workshops. So healthcare professionals, educators, and volunteers led these workshops, ensuring that students receive accurate and up-to-date information. And one more important thing is interesting thing is peer education and leadership programs. Post that we felt like this is not sufficient, and we started to recognize the influence of parents and the broader community. So we actively involved them in our school outreach program. We organize information sessions and workshops for parents, providing them with insights into disease prevention strategies and emphasizing the importance of their involvement in promoting a healthy environment at home. So yeah, these community events and initiatives such as health fairs or vaccination drives will further strengthen community engagement. And we came up with a detailed plan of action for cross-cultural communication skills that will eventually help all these students to make sure that they are identifying their problems and they're clearly articulating this and communicating with their loved ones. And healthcare camps in the schools is one other such thing, where medical checkup, screenings, consultations, and guidance are rapidly taking place. Health education sessions, in addition to these individual consultations, these health education sessions may cover a range of topics such as disease prevention, hygiene practices, uh, maybe in fact food, nutrition, mental health, and other relevant health related subjects. One thing that we have done, which is outside the plan of action, is collaboration with the local healthcare facilities to ensure that by leveraging their expertise and resources, we can provide comprehensive healthcare services and access to specialized care when needed. This collaboration fostered a stronger relationship between the school community and the local healthcare system, facilitating ongoing support and healthcare provisions. So we haven't just stopped there. We want to make sure that this continues. The more data we get, we'll come up with more refined models. And one more thing is, as I said, preventive healthcare is the most important thing. That's the main aim with whatever the surveillance project that we are doing. So eventually, we will be integrating all the other factors. In fact, we are even trying to integrate the social media and the web search, such kind of things, and also in fact, the school attendance scenarios also, such that we'll be able to stop the outbreak and spread of any disease then and there without it spreading it to other families. And the most important problem, in fact, the unfortunate scenario is when someone is actually affected with any of these chronic diseases and all, they don't even know why they were affected. That is, I mean, they don't even know what's the root cause. That is the most disheartening situation. That is emotionally weakening them, and that is causing all sorts of other side effects and mental health issues. And the main problem here is they're not even able to speak it out. That's the main problem. These patients are not even in a position to articulate these things even with their loved ones. This is causing an internal war. In fact, they are waging a huge war with their own brains, with their own psychological situations every day internally without expressing anything to anyone. So we wanted to make sure that we will be helping all these. We will help all such individuals and make sure that even they lead a happy life. And also, our ultimate goal is to establish equity in the healthcare, no matter what. I hope you understood this whatsoever and the importance of climate change. And if someone is actually willing to join our initiative, you're most welcome. Yeah, if you have any